You're watching NBC for New York. This is News for New York.
Still ahead with the swine flu spreading so quickly, we are separating fact from fiction for you this morning.
What you need to know to protect yourself and your family. Advice from a doctor when Weekend Today in New York comes right back.
Welcome back on this Sunday morning. We have been hearing so much lately about the seasonal flu, the swine flu, and that new vaccine, the controversy surrounding it, the shortages of it. Well, this morning we're going to try to help you sort it all out. And here to help us separate fact from fiction, Dr. Todd Schaeffer. He's actually a sinus surgeon from Manhasset, Long Island. Good morning, Dr. Schaeffer.
Hi, how are you?
How are you? I imagine flu's got to be really bad before folks get to the point where they need to see you, but you can certainly help us sort out the fact from the fiction about the swine flu in particular. We've seen just incredibly, it's just exponentially increased since last year, the rates of people that are contracting the virus. Tell us, let's talk about the basic differences between a flu and a cold, something that would lead someone to you with a sinus infection or something that needs to be treated. A lot of them have the same symptoms, right?
That's correct, Pat. A lot of these problems have a great deal of overlap of nasal congestion, sinus drip, mucus, throat problems, headaches, fever, chills, body aches. All these symptoms are very similar. So it's sometimes even difficult, not only for the patient to differentiate the difference between these problems, but even for the doctor sometimes.
Absolutely. But I think the next couple of symptoms that we're going to look at when it comes down to swine flu, vomiting and diarrhea are also common with the regular seasonal flu, but they're more intense. Is that the difference between the swine?
Well, I think we're seeing that more often as opposed to some of the other viruses or cold symptoms. We can see that also. It's not predominantly that. The predominant symptoms for the flu are the body aches and pains, fever, cough, and sore throat.
So how do you know when you pass that line from the seasonal flu, which we're all kind of used to dealing with, to this H1N1 that people are actually fearful of more so than the seasonal flu because it's so new? I mean,
well, that's sometimes very difficult to differentiate, but for the most part, the flu, sometimes very self-limited, just lasts a few days and it's gone. Just the way people have colds, comes and it goes away. So it's very short-lived and it goes away. If it persists, you have high fever, you have persistent fever that doesn't go away with Tylenol or acetaminophen, or you start getting respiratory problems with your breathing, then that's something that could indicate that you may be having a complication of the flu.
Exactly. Now, here's this one I'm sure you can address, the sinus infection. A lot of people mistake a sinus infection. Oh, I think I've got allergies. How do you know the difference between a sinus infection and a flu?
Well, that's something I commonly see. I'm an endoscopic sinus surgeon, so we see patients that come in with congestion, drip, headache, and to help differentiate that, I'm able to look in the nose and see what's going on, but certainly patients that have itchy symptoms, tearing of their eyes, that's more allergy related, facial pain, pressure over the sinuses, that's more indicative of a bacterial infection, which may require further treatment with antibiotics.
And speaking of treatment and that vaccine, a lot of people saying they don't trust this new vaccine. You heard the Nurses Association, they didn't want to take it. The health workers don't always want to take this mandated vaccination. What do you think?
Well, I think the best way to prevent the flu, because that's what everyone wants to know, you should be vaccinated. Okay, there's several vaccines out there, a nasal spray and an injection, and there are certain groups that are very high risk of getting the complications of this flu, and these patients should definitely get the vaccine. So
many more young children are being impacted by the swine flu than the seasonal flu, and so much earlier in the flu season. What do you make of that?
Well, that's what has everyone on a heightened alert, is that this is a little earlier than the regular seasonal flu, and it's affecting different groups. Pregnant women are being affected more. The children are being affected more. And it seems that the older people finally get a little bit of a break because they're not being affected as much the seasonal flu.
Sure. So it normally doesn't peak really until January, right? The flu season?
It peaks the end of January.
At the end of January. And so much more, oh my gosh, we've got a long way to go with this, don't we?
Well, probably, but the thing is we don't know, is it going to peak early and then be less as we go on, or is it just going to continue and plateau or get worse? That's the mysterious part of this. We don't know. But fortunately, a lot of people are keeping a very close eye on it. The CDC's been on top of this and keeping us informed, and I'm sure you're keeping your patients informed, and thanks for helping keep us informed this morning. Thank you, Dr. Todd Schaeffer. Appreciate you coming in. Be well.